News from the AstraZeneca vaccine has taken us on a wild ride the past few months. From incomplete data to reports of blood clots, people are wondering what's going on and whether they can trust this vaccine or not. If you're one of those people, we're here to break down what we know so far and to couch it all in the appropriate context. That's the topic of this week's Healthcare Triage. According to studies, the AstraZeneca vaccine is 100% effective against severe COVID-19 and 76% effective against symptomatic disease. As you may know, the company initially released trial results in March, shortly after which concerns were raised that the numbers they reported were based on outdated information. These concerns were raised by the National Institute of Allergy and Infectious Diseases, which is part of the NIH, who helped conduct the trial. They spoke up after hearing from the Data and Safety Monitoring Board that was auditing the trial, which said updated information suggested the vaccine's efficacy looked more likely to be between 69 and 75% effective. This was serious, but the potentially outdated numbers on efficacy against symptomatic disease was 79%, sliding just 3% when updated. The efficacy against severe disease did not change, though it's worth mentioning that that number is based on just 8 cases of severe COVID-19 observed in the placebo group. According to a Stat News report, those initial numbers were based on 141 COVID-19 cases in the study, which included 32,000 patients, and the updated numbers were based on 190 COVID-19 cases. We're not saying it's great that this mix-up happened in the first place. We're just happy to see that the final number didn't drastically drop, because increasing the supply of effective vaccines is a welcome development in our book. We also hope to stress that instead of the situation making people wary of the vaccine, let it serve as an example of the safeguards in place to ensure vaccine safety. This is a good example of one of the safeguards working. AstraZeneca plans to file for an emergency use authorization in the United States, and according to Stat News, the FDA plans to do its own analysis of the trial data when making their decision. And what about those blood clots? The vaccine has already been in use in other countries, and news broke in March that several European countries were temporarily suspending its use based on blood clot concerns. On April 7th, the European Medicines Agency Safety Committee reported that unusual blood clots with low blood platelets should be listed as a very rare side effect of the vaccine. These clots were found to occur in blood vessels in the brain and abdomen and in arteries, and sometimes occurred alongside bleeding. The recommendation to list them as a very rare side effect was based on an in-depth review of 86 cases, 18 of which were fatal. We understand how scary that sounds at face value, and we do not minimize the tragedy of those 18 cases. It is our responsibility, however, to emphasize how very rare this side effect is. Please keep in mind that these cases came from reporting systems where, according to the report from the European Medicines Agency, around 25 million people received the vaccine. We also don't want to minimize the tragedy of lives lost to COVID-19, and it is in that context that we have to say the benefits of this vaccine heavily outweigh the risks. According to another Stat News article, current estimates report this side effect occurring as high as 1 per every 100,000 vaccinations and as low as 1 per every 250,000 vaccinations. It is critical to understand those estimates in relation to the risk of blood clots in other situations. To help you do that, consider the following. Obese individuals from high-income countries experience strokes at an estimated rate of 6.1 per 100,000. In case you need context, remember that most strokes are the consequence of a blood clot blocking or narrowing an artery leading to the brain. The risk of stroke for women who take low estrogen oral birth control is estimated to be about 4.1 per 100,000. For pregnant women, this estimate appears to land somewhere between 3.8 and 18 per 100,000. And most relevant to the current situation, the odds of having a stroke if you contract COVID-19 and require hospitalization are estimated to be about 1,400 per 100,000. We should note that all of these estimates vary based on many factors, including the type of stroke, but putting the risk in context remains relevant. So keeping that in mind, let's summarize the risks we just mentioned. Using current estimates, the risk of stroke when getting the AstraZeneca vaccine is lower than the risk of stroke for obese individuals from high-income countries, lower than the risk of stroke for women who are taking birth control or who are pregnant, and is significantly lower than the risk of stroke for individuals who contract and are hospitalized with COVID-19. Some people have asked why they should take it if there's any risk at all. And we say for the same reason you may choose to do other things that carry risks. because there are outcomes you deem beneficial that outweigh the risks you face by doing it. In the case of the vaccine, the beneficial outcome is to protect yourself against COVID-19, including potential hospitalization and blood clots. Or, if you feel your risk for that is too low, another beneficial outcome is protecting those around you who aren't so lucky to be at a risk level that they feel is negligible. This has too rarely been communicated in the media firestorm surrounding this issue. Undermining confidence in this vaccine is a major problem, particularly because this one is easier to manufacture and distribute and is more affordable than some of the other vaccines, meaning it could be particularly useful in ensuring high vaccination rates all over the world. However, people need to feel confident taking it, and so far public confidence has taken some major hits thanks to current messaging. We hope this video can help to counteract that. Hey, did you enjoy this episode? You might enjoy this previous episode on how dark chocolate isn't a superfood. We'd also appreciate it if you'd like and subscribe down below, and consider going to patreon.com/healthcaretriage, where you too can help support the show even during a global pandemic. We'd like to especially thank our research associates, James Glasgow, Joe Sevitz, Josh Gister, and Michael Shin, and of course, our Surgeon Admiral, Sam.